Morning, good evening, good afternoon. This is Dr. Garais, MED104, and we are now going to venture into chapter 3. Let's see, in the right place? No, I'm not in the right place. New channel. That's not, here it is. Okay. So this is chapter 3, integumentary system. Ary is one of those suffixes that mean pertaining to what system? Your integument, which is another word for skin. Dermat is another root for skin. So dermatology, logi, study of. If you remember my little facetious story about Dr. Abby, I called her the other day and I told her about that story. She was not appreciative of it. Still kind of sore at me for that, but that's all right. So let's jump right in. Dermatology. Of course, your skin is your protection. Dermat, right? Skin. Logi, study of. And it has skin, and the upper part of the skin is called your epidermis. Is just like structure of epi, upon or right on top of your dermis. The dermis is the main one. Remember your glands, the root of gland is adeno. So you have your sebaceous gland, us pertaining to your sebum, and this is the your oil glands. So sebum means oil, and your sebaceous glands have to do with oil. Because the skin your skin's got to be a little bit oily so it can stay supple and soft. Squamous cells, OUS, is means pertaining to squamous, or squat means it's flat cells, and that's what your epidermis is. It's kind of like a set of like shingles and shields to protect yourself. And of course, your dermis, the main part of your skin. And you see, I'm going to skip through a lot of stuff and only focus on the medical terminology, because in many schools they have the medical terminology and the anatomy and physiology all at once. So again, I'm going to only focus on words that are good and important in the integumentary system. Nerves, we already know. Nervous, OUS, pertaining to your nerves, right? Remember the word neurotic, neuroses. If someone has a neurosis, it's osis, abnormal condition of your nerves. Glands, we already went. Adeno. Sebum is the oil, that's your sebaceous glands. Fat, there's several words we already learned about fat. So adipocytes, or adipose tissue. Cyte means cell. CYTE means cell. So an adipocyte is a fat cell. Lipocyte is a fat cell. Steatocyte is a fat cell. Adipose tissue, fat, right? Lipids, fat. And what word comes to mind was steatorrhea. Steatorrhea. Rhea means excessive flow. It's a kind of diarrhea that's got what? A lot of fat in it. Skin, we already learned cutaneous, subcutaneous, underneath the skin. Epidermis, right above the skin. And of course, dermatology, the study of skin. And yes, people who are dermatologists are MDs. They went to medical school, right? And then they have the specialty of the skin. Your hair is tricho. So if you have what's a good word I'm thinking off the top of my head? A piloneedle cyst. It's a cyst that's gonna have what? Like hair in it. It's kind of weird. You can look that up. You can Google it. It's pretty weird. Trichosis. Osis is abnormal condition. We already learned that. Trich is hair. So if my patient has trichosis, they have some abnormal condition of hair. Hyder looks like hydro because it's sweat and sweat's water. So hydrosis, abnormal condition of sweating. Hyperhidrosis is excessive sweating. Most likely means that either you have a break in your fever or you have some sort of neurologic. Squamous or squat or scale-like. Nail is onycho. And We already learned the word mycosis. It was on our quiz. So if my patient has an onychomycosis because they went to a bad hair and nail joint, and that's actually why nail places are monitored by the board of nursing. Ungo, off the top of my head, I can't think of any words, but onycho is a little bit more common. So onychomycosis, osis, abnormal condition of the nail. Myco is fungus. Sebaceous glands, we already talked about sebum. Means structure of. Structure of what? Sebum, the oil. If I'm going a little fast, this is the beauty of having a what do you call that? The pause function. So I'm just putting it out there because I'm barely 5 minutes in and I'm on like slide 10 already. Very different from the lecture because in the lecture I'm always trying to tell a story so that you can relate to it. Unusual skin texture. Kerato means like for keratin. Keratin is a protein that makes your skin tough, but if you have keratosis, it's an abnormal condition where your skin is too um do they start talking about? Oh yeah, here it is. They start having examples. So Corrado, Zero, Crypto, Leuco, Erythro, Xantho, Milano. Oh, these are colors. We already learned Leuco is white, Erythro is red, Xantho is yellow, and deals with also fat. And Milano is either black or really, really dark brown. Cerato is hard, Zero is dry, and Crypto is hidden. So if you have keratoderma, that means it's very hard skin. Onychoceratosis, right? Is like hidden nails. I don't know. I like onychomycosis. It's a more common term. Xeroderma, very common term, dry skin. And keratosis is abnormal condition of hard skin. Same thing with keratin, horny tissue. Keratin is makes your skin tough. So keratoderma and keratosis, they fall within the same category. Albinism, that when my patient doesn't have any melanocytes. Melanocytes give your hair, eyes, and skin the color. And a person who is an albino ism, of course, like disorder of or disease of albino. That's white. Melanoma, oma means tumor. Remember, tumor doesn't mean cancer. Tumor just means lump or bump until after the biopsy. And melanoma can be benign or it can be malignant, but until after the biopsy to confirm, we don't know. Leukotrichia. Now, leuko we already know is white, right? So tricho, already we know it means hair. So of course, leukotrichia is when you get, white hair or you get it prematurely. Erythroderma, erythro means red, derma means skin. So if you get a little bit flush, my patient is said to have erythroderma. Axanthopsia, unable to see the color yellow, not a very common. But these albinism, melanoma, leukotrichia, and erythroderma, way more common. This one, I, I've only seen that in textbooks. I've never seen that in real life. And melanin we talked about, and that is a substance in your dermis that gives you, your skin color. It also gives your eye color and your hair color. Let's look at some terms here. Dermatalgia, dermatodynia, right? That's what your skin is in pain, but that's hard to this and this is a more academic term than a real life term. But this term, pruritus, that's real term. Urticaria, that's also a real term. I think let's see if they go through the terms just to check real quick. No, so I'll go over it. So pruritus is one of those, it's the itching that won't stop, and it's extreme itching to the point where you scratch, and even if you got a cut, you'll keep on scratching, and that's pruritus. Uh, Urticaria, that's like, allergic reactions. Seborrhea, excessive flow of your sebum. It's very oily skin. Xerosis, very dry skin. Hyperhidrosis, Macerate, we don't really use that word. But hyperhidrosis, a lot of sweating. It's like somebody poured a bucket over your head. If anyone listening to this lecture ever had like a really high fever of like 102, 103, when your fever breaks, you will have hyperhidrosis. You'll start sweating like some like someone poured a bucket of water over your head. It's that dramatic. Anhydrosis, that means you don't sweat at all. And again, that could mean either a nervous system condition, a neurologic condition, or a endocrine problem. Depigmentation, of course, D is the prefix that means no or not, and your pigmentation is due to your melanin. Or you can have the exact opposite, hypermelanosis, way too much dark color in your skin. Alopecia, we already know. Thank you, Smith family, for introducing the world to alopecia. And of course, the exact opposite, hypertrichosis. You see, we have a couple of opposites in this particular lecture. Doesn't that look like an A, B, both A and B question? And remember, if you have two sides of the same coin, memorize one side like your life depended on it, and the other side is simply the other side. A comedone. Uh, Comedo or comedones, those are, when you scratch your back and you like have like little pebbles that come out of your skin. Well, it's like dried up sebum and skin cells and stuff like that. Oh, now I'm devolving into a dermatology lecture. Let's not go there. We already went through this dermatolysis, breakdown of your skin. Hematidrosis, you actually bleeding blood. That's again, it's rarity. And again, these are more dermatology, and dermatodynia is more of an academic term. Xanthoderma, really, really popular. That's when your skin, especially if you have hyperlipidemia, you have way too much lipids, it starts seeping into your skin. When it's summertime again, someone with like, you ever see like their skin is like yellowish and like cottage cheese like, and it starts weeping out sweat that's like kind of yellowish, and that's xanthoderma. It means that you have most likely type 1A hyperlipidemia. Hyper, too much. Lipid, fat. Emia, in your blood or blood condition. Oh, I'm starting not to like your textbook. It strays it it strays into clinical. We don't need that. We need to just know about medical terms. See, this is like clinical stuff. Like what's a vesicle? What's a bullae? You guys aren't in dermatology yet, but what looks good? Pustule. Pustule is like a tumor or a lump or bump that's filled with pus. And remember what pus is. Pus are white blood cells and probably dead bacteria. And that's never a good thing. Now, when we don't take care of the pus, it gets worse. And remember, necrotic tissue beget more necrotic tissue, or dead tissues beget more dead tissues. And then it turns into an abscess. Remember sequelae? This stuff gets into your blood, then you have septicemia. That's bad news all around. So pustule and abscess, I like that better. The rest, the rest is starting to get into, I don't know, clinical stuff. And angioma, let's talk about that. Oma means a tumor. Remember, tumor doesn't mean cancer to us. Tumor means mass, means lump or bump until the biopsy tells me it's cancer. So angio is a blood vessel. So an angioma is a tumor made up of a blood vessel. I mentioned the word ecchymosis during today's lecture as well. Ecchymosis is a bruise, but petechiae they're like these tiny little red dots. But ecchymosis is, like black and blue. You can really see it, and it's our osis, abnormal condition. You shouldn't have big bruises. Burns, you don't need to know. Scar formations, cicatrix, keloids. Keloids are very, very common in people who have a lot of melanin. So if you have darker skin, it tends to form an exaggerated scar, and that's called a keloid. Uh, these nice to know. Pathology. Remember the word biopsy. Okay. Excisional, of course, I have to excise it or I take out a piece. And incisional, I cut into it and then take a swab. Okay. So what's a biopsy? Capital B, lowercase x. Opsy is the process of viewing. Remember the hint. A lot of you guys got that electrocardiography question wrong because Y at the end connotes what? Process. So opsy is the process of viewing, bio is life. You actually want to look at life. And who does a lot of biopsies? The Department of Dermatology. And they look at a special microscope called a dermatoscope. That's the actual instrument. But dermoscopy is the actual process of looking in that special microscope. Okay. And we can either have excisional, I X. What do I do with my X's? I get them out of my life, right? So my excisional biopsy, I'm getting the material out of the body. But the incisional, I cut into it and then I swab. Adipocele, fat cell, dermatofibroma, fiber. That means the oma, the tumor, is made out of fibers and it's like thick. And erythrocyanosis, cyan means blue, right? Erythro means red. So my patient has what? Redness in some areas and they look a little bit pale or bluish in areas. And for you, if you're wondering what does the color cyan or blue look like in a person of color, it's when they look a little bit ashy. Necrosis, we know. Steatoma is like a lipoma. Oma is just a tumor, lump or bump, mass, lump or bump. But if a biopsy comes back and it's steatoma, also known as a xanthoma, that means it's filled with fat. Here's some Onico words. Onychomalacia, softening of the nails, most likely due to either vitamin deficiency or some sort of fungus. Onychopathy, that's what disease of their nails. Onychophagia, it's someone who likes to eat their nails. That's my sister. It's pretty gross about that. I love sharing too much. It's part of who I am. Let's see. Oh, decubitus ulcer. An ulcer is an abnormal opening or like a degeneration in the covering of something, and it's like a ditch that shouldn't be there. And a decubitus ulcer. Those of you who know anything about, or maybe those of you who are certified nursing assistant and work in an assisted living, you guys, or someone who works in, a more chronic care, you find little wounds in the skin of, the back part of your butt and the back of your head and also the top part of your, the middle part of your neck, right? Those are classic places where you get bed sores, and those bed sores are called decubitus ulcers, and they can get really nasty, and they can even lead to the sequelae of septicemia. Never a good thing. Oh, ichthyosis, scaly skin, abnormal. Ichthy means fish or scales. Sclerodermatitis. Sclero means hardening of. So the hardening of your skin. It's nice. Tumors can either be malignant or they can be benign. Okay. So I want you to know those words. A melanoma, oma, is a tumor of melan. So it's a colored tumor. And the color is typically dark brown. Looks kind of black, but it's more dark brown. And that's what a melanoma looks. BCC, basal cell carcinoma, you definitely know it's what? Malignant. A carcin is definitely cancer. SCC, squamous cell carcinoma. Mycosis, you see there's a lot of wash, rinse, and repeat. Acne, very common. The other ones, again, I don't want to. I don't want this to devolve into a remember, there's medical terminology. It's not dermatology, nor is it clinical. Treatments and therapy, Mohs surgery. I don't need to know that. Epidermal, epi, right on top of your skin. Intradermal, within your skin. Subcutaneous, all the way into the fatty layer, right? Percutaneous, per and trans means what? Through. If some so percutaneous, like let's say I'm doing a percutaneous something or other, whatever it is, I'm going right through the skin. Transdermal patch, that medication is going right through the skin or right across the skin. Trans means across, per means right through. And topical, taupe, we already talked about. Taupe means topo means area, right? So if I have a topical cream, you put it over the area, okay? Or over the affected area. Chemo means chemical. Electro means electricity. Electrocauterization is really neat. It's a way that I can cut into you and also kind of close things up using electricity. We kind of like burn you a little bit. That's what that is. IND is a very common what do you call that? It's a common abbreviation or acronym, means incision and drainage. Let's say you have a pustule or no, an outright abscess, right? It's nasty, it's big, it's got a lot of pus, it's got a lot of necrotic tissue in it. So I have to do what? I have to cut an incision. It's usually gravity dependent. Then I drain it out. I either put a tube in it, and you'll see, you can look it up, and Jackson Pratt, or I put a Penrose tube in it, and then it kind of like you know, gets all that nastiness out. Ectomy, we cut things out so I can have a lipectomy. Liposuction, of course, we that's a misnomer actually. It sucks out all the fat, but you have to actually scrape all the fat out. It's just really rough. You want to be grossed out, look up a liposuction procedure on YouTube. Here's a nice one, medical term. Heterograph, xenograph, homograph, and autograph. So what's one? What? And look at it's even doing my job for me, right? Heterograph. Hetero goes means what? From somebody else. Xeno from something foreign or another species. Homograph means from the same. Homo means the same. We do that a lot with burn patients. So let's say, for example, I got my whole chest burned. Well, they grab the skin from like back of my leg and my back, and they can graft it on the front. And autograph is another way of saying homograph as well. This is a nice question. Nice to come out. Hint, hint. Antipruritic, anti is against. Against what? That extreme itching. Antibiotic, we already know. Anesthetic. Ik pertaining to, an is the prefix meaning no or not. Aesthesi means to feel. So when you're giving we're giving you a local anesthetic. Let's say I want to suture up like a like maybe some cut you have on your hand. I'll give you a local anesthetic, and it's called a hand block. And what will it do to me? It'll give me a situation where there is an prefix, no or not, aesthesi, which is feeling, no feeling. Antiseptic, of course, sepsis we know is a bunch of organisms we don't want around, kind of like antibiotics, but anti means against. An antihistamine that prevents allergies because mast cells get activated in allergies and release histamine, and that's where you get all those nasty symptoms of like hay fever and such and such. And I can give you an antihistamine, anti against, allergies or against histamines. What abbreviations look good here? BX, right? Capital B, lowercase x, biopsy. CNS, culture and sensitivity. Every time we're doing like a wound swab, right? We swab it with like this sterile, like big long Q-tip thing. And then I sent it to pathology for a CNS. CNS means culture and sensitivity. First, I got to grow whatever's on that nasty Q-tip. And then I do this other test to see what antibiotic kills it the best. So that's what a CNS is, a culture and sensitivity. I grow the bacteria and then I see what medication or what antibiotic is would best kill it. Derm is more like if you look at all the logis, they use as medical slang. Like dermatology would be derma, neurology would be neuro, cardiology would be cardio, nephrology would be nephro, like that. IDSC, SQ, and IM. ID is intradermal. IN is intramuscular. SC is subcutaneous. SQ is subcutaneous. Medical records, EHR, electronic health records. Yet another acronym. Good to know. And I think that's it. End of presentation. All right. Thank you very much for joining me. And I will see you in class. Uh, Microsoft Teams. Am I here?